Everybody, Anne here from Parenting Peace. I am on day 7 of my 21-day challenge, doing my head-to-toe MOT of babies and minor ailments. So today I am going to be talking about the management of oral thrush. Now, what is oral thrush and how do you recognize it? Well, oral thrush is really common in young babies. And how you'll recognize it is it's like little white plaques on the tongue, on the mucous membrane. So it can be inside of the gum, in here, also on the underside of the lip and the roof of the mouth. So it's not just always on the tongue. Now, some parents get confused when the tongue is coated in white, and that's quite common for the tongue to be coated in white, especially when you're a breastfed baby, because the tongue kind of laps around the nipple when baby is latched on. But the way that you'll recognize thrush is that when you try to rub it with some clean muslin cloth, it doesn't go away. Now, what are the causes of thrush? Well, there are a few reasons why babies get thrush. One is that they could be on antibiotics, or the mother, if she is breastfeeding, is on antibiotics, because that lowers the immune system. If a baby is bottle fed, sometimes it can be due to insufficient kind of sterilization of the teats of the bottle, or if the baby is having a dummy or soother, it can be that the hygiene isn't top notch for whatever reason, no fault of the parent at all. It happens, okay? So thrush can be a bit irritating for the baby because it can cause a little bit of pain, especially if it's not picked up early. So I would really advise you to get into the habit of checking your baby's mouth after a feed. So just have a little look in, make sure that you look on the roof of the mouth and on the insides of the cheeks, because that is where you will find them. And that can be advanced stage of thrush, really. So how do we manage thrush? Well, it's really simple to get rid of thrush. It is a fungus called Candida, and it responds very well to antifungal medication. So you will need to go to your GP because you can't get this over the counter, unfortunately. Now, most GPs will prescribe nystatin or microstatin, and that will be in drop form. So you'll have to drop it into your baby's mouth. Now, do try and make sure that you drop it to the side rather than straight down, because it will just go down the gastrointestinal tract. And just try and massage it in at both sides. So you'll have to give them a couple of drops. Now that's the first line of treatment, and there is a second line of treatment as well. But the thing with oral thrush is that if it's gone on for quite a while, it can actually go through all of the intestinal tract, so all the way down through the tummy, through the intestine, and it can come out on the baby's bottom, and they can get nappy thrush, which is also quite irritating and sore for the baby. So make sure that you check your baby's nappy area as well, because they may well need treatment for nappy thrush as well. Now, sometimes when you get really resistant thrush, and I used to see this a lot in babies, we had to change the medication from nystatin over to Dactarin. Now, with Dactarin, you get an oral gel that you just put on your finger and you rub it into the insides of the gum and on the tongue and the roof of the mouth. But you will also need to ask the GP for Dactarin cream to put on the nappy area. Now, if you are a breastfeeding mum, I'm afraid what can also happen is that the baby can transfer oral thrush to you, and you will get thrush on your nipples, and this is quite painful as well. Now, really important, if you are experiencing pain while breastfeeding and your baby has thrush and it's not down to cracked nipples or poor positioning, it could well mean that you have picked up some thrush. Now, in the nipple area, it looks a bit like a pinprick rash elevated around the areola. So if you are experiencing soreness in this, then you will need to be treated also with Dactarin cream. It's perfectly okay to keep on feeding through oral thrush, and if you have got thrush on your nipples, but what is really important is that you both get treated, or else what will happen is that you'll just keep on reinfecting each other, and it kind of goes round and round in circles. Okay, so that is my top tips today for the management of oral thrush in you and your baby. Tomorrow I will be live talking about tongue tie and lip tie and the implications of that for your baby. If you have enjoyed this live, please do give me a like or a comment. I'd really appreciate that, and please do like my page as well. So I look forward to seeing you tomorrow at 9:30. Until then, have a great day, everybody. Bye bye.